Explain the principle of PCR, polymerase chain reaction, and discuss how real-time PCR differs from traditional PCR. What are the advantages of real-time PCR in clinical diagnostics? Answer: PCR, polymerase chain reaction, is a molecular technique used to amplify specific segments of DNA. The process involves three key steps. Denaturation. The DNA sample is heated to around 9498 to separate the double-stranded DNA into single strands. Annealing. The temperature is lowered to allow primers to bind to their complementary sequences on the single-stranded DNA. Extension. The temperature is raised to allow DNA polymerase to extend the primers, creating new strands of DNA. Real-time PCR, also known as quantitative PCR, is an advancement of traditional PCR. Unlike traditional PCR, where products are analyzed at the end of the process, real-time PCR allows continuous monitoring of the amplification process in real time. This is achieved through fluorescent dyes or probes that bind to the amplified DNA, emitting fluorescence that can be detected after each amplification cycle. Advantages of real-time PCR. It provides quantitative data, allowing the measurement of the amount of target DNA in a sample. It reduces the risk of contamination since products are detected during the reaction. It offers faster results and more accurate quantification compared to traditional PCR. Real-time PCR has become indispensable in clinical diagnostics, particularly in viral load testing, e.g., HIV, COVID-19, and detection of specific genetic mutations. Describe the structure of DNA and RNA. How do mutations in the DNA sequence affect gene expression and protein synthesis? Provide an example of a mutation leading to disease. Answer: DNA deoxyribonucleic acid is a double-stranded helix composed of nucleotides. Each nucleotide consists of a sugar molecule, deoxyribophosphate group, and a nitrogenous base, adenine A, thymine T, cytosine C, and guanine G. The two strands are held together by hydrogen bonds between complementary base pairs. Adenine pairs with thymine and cytosine pairs with guanine. RNA, ribonucleic acid, is single-stranded and has a similar structure but with ribose as the sugar and uracil, U, replacing thymine. There are three main types of RNA involved in protein synthesis. RNA, messenger RNA, carries the genetic information from the DNA to the ribosome. RNA, trans-RNA, brings amino acids to the ribosome for protein synthesis. RNA, ribosomal RNA, forms the core structure of the ribosome and catalyzes protein synthesis. Mutations in the DNA sequence can lead to changes in the mRNA transcript, potentially altering the protein produced. These mutations can occur in various forms. Point mutations: a single nucleotide change, such as a substitution, which can result in a different amino acid in the protein. Missense mutation: no amino acid change, silent mutation, or a premature stop codon nonsense mutation. Frameshift mutations: insertion or deletion of nucleotides that shift the reading frame of the mRNA, leading to an entirely different protein. An example of a mutation causing a disease is the sickle cell mutation, a point mutation in the gene encoding hemoglobin HEB. This mutation leads to the substitution of glutamic acid with valine, causing hemoglobin to form sickle-shaped structures, leading to sickle cell anemia. Mr. Thompson is a 45-year-old male with a family history of breast cancer. He undergoes genetic testing for BRCA1 mutations. The results come back positive for a mutation. What does this mean for Mr. Thompson, and what should be the next steps in his management? Answer: BRCA are tumor suppressor genes involved in the repair of damaged DNA. Mutations in these genes significantly increase the risk of developing certain cancers, particularly breast and ovarian cancer. BRCA mutations are associated with an increased risk of breast cancer in both men and women, although the risk is lower in men compared to women. For Mr. Thompson, a positive BRCA mutation result means that he has an elevated risk of developing breast cancer and possibly other cancers such as prostate and pancreatic cancer. Genetic counseling is essential to help Mr. Thompson understand his risk and the available preventive options. Next steps: Mr. Thompson should undergo regular screening for breast cancer, e.g. mammography, breast MRI, starting at an earlier age than the general population. Consider discussing options such as chemoprevention, e.g. tamoxifen, or surgical options, e.g. mastectomy, to reduce cancer risk. Family members may also be tested for the mutation to assess their cancer risk. Explain the technique and application of southern blotting in molecular diagnostics. How does it differ from northern blotting? Answer: southern blotting is a technique used to detect specific DNA sequences. Within a complex DNA sample, the process involves digestion of DNA with restriction enzymes to create smaller fragments, gel electrophoresis to separate the DNA fragments by size, transfer of the fragments from the gel onto a nitrocellulose or nylon membrane, hybridization with a labeled probe that binds to the specific sequence of interest, detection of the bound probe using autoradiography or chemiluminescence. Northern blotting is similar but is used for detecting RNA rather than DNA. The key differences are southern blotting is used for DNA, whereas northern blotting detects RNA molecules. In northern blotting, after RNA extraction, it is separated by gel electrophoresis, transferred to a membrane, and hybridized with a probe specific to the RNA sequence of interest. Both techniques have applications in gene expression analysis, but northern blotting is primarily used for studying mRNA levels, providing insights into gene activity. Discuss the role of molecular diagnostics in personalized medicine, specifically focusing on tumor DNA profiling in cancer treatment. Answer: molecular diagnostics plays a pivotal role in personalized medicine where treatments are tailored based on the individual's genetic profile. One important aspect is tumor DNA profiling, which involves analyzing the genetic mutations and alterations within a tumor's DNA. By profiling tumor DNA, clinicians can identify specific genetic mutations that drive the cancer. For instance, testing for HER, human epidermal growth factor receptor 2 amplification in breast cancer allows for the use of targeted therapies like trastuzumab, Herceptin, which specifically targets the HER protein. Other genetic markers such as BRCA mutations can guide the use of PARP inhibitors in certain cancers. The benefits of tumor DNA profiling include targeted therapies. By identifying mutations in genes like EGFR, ALK, or BRAF, clinicians can choose therapies that specifically target these mutations, improving treatment efficacy. Stratification of treatment options. Molecular profiling helps to identify patients who are likely to benefit from certain therapies and those who might be resistant, optimizing treatment outcomes. Mrs. Mitchell is 38 years old and undergoes genetic testing for cystic fibrosis as part of a prenatal screening program. The results reveal she is a carrier of a cystic fibrosis mutation. What are the implications of this finding for Mrs. Mitchell and her partner? Answer: cystic fibrosis (CF) is an autosomal recessive genetic disorder caused by mutations in the CFTR gene. If Mrs. Mitchell is a carrier, it means she has one normal and one mutated copy of the gene. However, she will not exhibit symptoms of CF because two copies of the mutated gene, one from each parent, are required to manifest the disease. Implications for Mrs. Mitchell. Mrs. Mitchell should inform her partner about the results, as both parents need to be carriers to have a child with CF. If the partner is also a carrier of a CF mutation, there is a 25% chance with each pregnancy that the child will inherit two mutated genes, one from each parent, and develop CF. If the partner is not a carrier, the risk of having a child with CF is extremely low, as only one carrier allele is present in the gene pool. In such cases, genetic counseling is essential for both parents to understand the risks and available options, including prenatal testing, e.g., amniocentesis or chorionic villus sampling, to check if the fetus has inherited the CF mutation. Describe the importance of contamination control in molecular diagnostic assays and the steps taken to prevent contamination during sample processing. Answer: contamination control is critical in molecular diagnostics due to the high sensitivity of techniques like PCR, where even trace amounts of contaminating DNA or RNA can lead to false positive results. Contamination can occur at various stages, from sample collection to processing, and can introduce external DNA that interferes with the accuracy of test results. Steps to prevent contamination: dedicated areas for sample handling, separate areas for pre- and post-PCR steps to prevent cross-contamination, use of barriers, wearing protective clothing, gloves, and face shields to reduce the chance of contaminating samples, decontamination, regular cleaning of work surfaces and equipment with UV light or chemical decontaminants like bleach, sterile consumables, use of disposable pipette tips, tubes, and gloves to avoid introducing contaminant DNA or RNA. Quality assurance programs such as positive and negative controls in each assay help to monitor and validate the results, ensuring that the assay performance is not compromised by contamination. Explain the concept of genetic inheritance and the role of polymorphisms in determining an individual's susceptibility to diseases. Answer: genetic inheritance refers to the process by which genes and their associated traits are passed down from parents to offspring. It follows the principles first described by Gregor Mendel, who established the laws of inheritance. dominance, segregation, and independent assortment. Polymorphisms are variations in the DNA sequence that occur among individuals in a population. These can be single nucleotide polymorphisms (SNPs), which are single base changes in the DNA sequence. While many polymorphisms are benign and have no effect on health, some can influence an individual's susceptibility to diseases. For example, polymorphisms in the APOE gene polypoprotein are associated with an increased risk of Alzheimer's disease. Similarly, certain polymorphisms in the BRCA genes are linked to an increased risk of breast cancer. Understanding these polymorphisms allows clinicians to predict the risk of developing certain diseases, making genetic testing a valuable tool in personalized medicine. What are the main challenges associated with interpreting sequence data in molecular diagnostics? Answer: interpreting sequence data from DNA or RNA samples presents several challenges due to the complexity of genetic information and the variety of mutations that can occur. Challenges include variants of unknown significance. Thus, many genetic variants have unknown clinical relevance, and classifying them as pathogenic or benign can be difficult. Comprehensive databases and additional research are often required to determine their significance. Clinical context: the interpretation of sequence data must be done within the clinical context. A variant that is benign in one population might be pathogenic in another, and a gene mutation's impact can vary depending on the patient's history, family background, and other genetic factors. Heterogeneity: some diseases are caused by multiple mutations across different genes, which complicates the diagnosis and interpretation of sequence data. To mitigate these challenges, bioinformatics tools, updated variant databases, and collaboration with clinical geneticists are essential for accurate interpretation and clinical decision-making. How do mutations in the BRCA/DREA genes increase the risk of developing breast cancer, and what role does genetic testing play in identifying at-risk individuals? Answer: mutations in the BRCA/DREA genes significantly increase the risk of developing breast and ovarian cancer. These genes are involved in DNA repair mechanisms and maintaining genomic stability. When either gene is mutated, its ability to repair DNA damage is compromised, leading to the accumulation of mutations in other critical genes, which can result in cancer BRCA mutations. These are associated with a higher risk of breast cancer, up to 72% lifetime risk, and ovarian cancer, up to 44% lifetime risk. The mutation impairs the ability to repair double-stranded breaks in DNA area mutations. These also increase breast cancer risk up to 69%, but have a slightly different cancer profile with higher incidences of prostate cancer and pancreatic cancer. Genetic testing for BRCA mutations involves sequencing these genes to identify any mutations. Carrier testing is often performed in individuals with a family history of breast or ovarian cancer. If mutations are identified, healthcare providers may recommend preventative strategies such as increased surveillance, prophylactic mastectomies, or ovarectomy to reduce cancer risk. What are the key principles of antigen-antibody reactions in blood typing, and how do they affect compatibility testing? Answer: antigen-antibody reactions in blood typing are crucial for determining the compatibility between a donor and recipient for blood transfusions. The primary principle is based on the interaction between antigens present on the surface of red blood cell (RBCS) and corresponding antibodies in the serum. For example, in the ABO blood group system, individuals with type A blood have antigens on their RBCS and produce anti-B antibodies. Compatibility testing ensures that the recipient's antibodies do not react with the donor's red cells. If incompatible, a hemolytic reaction could occur. Incompatibility testing is performed through cross-matching, a test where donor RBCS are mixed with recipient serum to observe if agglutination occurs. If agglutination is seen, it indicates a mismatch and the transfusion should be avoided. The FDA and AABB guidelines provide regulatory standards for performing these tests to ensure safety. Mr. Thomas, a 45-year-old male, requires a platelet transfusion after undergoing chemotherapy. The blood bank has multiple units of platelets available. What criteria should the blood bank technician use to determine the best unit of platelets for transfusion? Answer: in this scenario, the blood bank technician must consider several critical factors when selecting the appropriate platelet unit for Mr. Thomas. Compatibility testing: while platelets are less likely to cause severe reactions than red blood cells, cross-matching may still be performed to minimize the risk of alloimmunization, antibody formation against transfused platelets. The technician should cross-match the available platelet units with Mr. Thomas's serum to ensure compatibility. Platelet count and quality: the technician should assess the platelet count and ensure that the unit is not expired. Platelet storage is typically at room temperature for up to 5 days, and the quality of platelets can degrade after this period. Special considerations: for immunocompromised patients like Mr. Thomas, irradiated platelets may be recommended to prevent graft versus host disease (GHD), especially if Mr. Thomas has a history of transfusions. Leukocyte-reduced platelets should also be considered to reduce the risk of febrile transfusion reactions. Donor screening and risk management: the technician should verify that the donor passed screening protocols as per AABB and FDA regulations, ensuring the platelets are free from transmissible infections. Explain the significance of the Rh system in blood transfusions and the consequences of Rh incompatibility. Answer: the Rh system involves the presence or absence of the Rh factor, specifically the D antigen, on red blood cells. If a person has the D antigen, they are Rh positive Ra; if not, they are Rh negative Rh. This distinction is vital in transfusions because Rh incompatibility between donor and recipient can lead to severe immunologic reactions, particularly in Rh negative recipients. For example, an Rh negative patient receiving Rh positive blood can develop antibodies against the Rh antigen, leading to hemolytic transfusion reactions. In future transfusions, these antibodies will attack Rh positive red blood cells, causing severe hemolysis. In pregnancy, Rh incompatibility between an Rh negative mother and an Rh positive fetus can lead to hemolytic disease of the newborn HDN. To prevent this, Rh immunoglobulin (RIG) is given to Rh negative mothers to prevent the formation of anti-H antibodies after exposure to Rh positive blood cells during pregnancy or delivery. How does the blood bank manage the storage and preparation of blood components, and what are the key regulations involved? Answer: blood components such as red cells, plasma, platelets, and cryoprecipitate require specific storage conditions to maintain their integrity and functionality. Red blood cell (RBCS). These are typically stored at 2,6 for up to 42 days. Proper refrigeration ensures the preservation of the RBC membrane and minimizes hemolysis. Platelets. Platelets are stored at room temperature 2024 with continuous agitation to prevent clumping. They have a shelf life of 5 days and must be checked for signs of bacterial contamination. Plasma and cryoprecipitate. Plasma is frozen at -18 or colder and can be stored for up to 1 year. Cryoprecipitate is also frozen and stored similarly, but has a shorter shelf life, up to 6 months. Regulations. The FDA regulates the storage and handling of blood products, ensuring compliance with safety standards. AABB guidelines provide detailed instructions on processing, labeling, and tracking blood products to prevent errors and contamination. Mr. Hargrove, a 60-year-old male with a history of cardiac disease, is being transfused with plasma after undergoing surgery. He develops signs of respiratory distress shortly after the transfusion. What might be the cause, and how should the healthcare team respond? Answer: Mr. Hargrove may be experiencing transfusion-related acute lung injury. TRALI is serious but rare transfusion reaction. TRALI typically presents with respiratory distress, hypoxemia, and bilateral pulmonary infiltrates, usually within 6 hours of transfusion. Causes: TRALI is believed to be caused by donor antibodies, especially in plasma, reacting with the recipient's leukocytes, triggering an immune response that leads to pulmonary edema. Is more common in plasma from female donors who have previously been pregnant, as they may have developed antibodies against human leukocyte antigens (HLA) response. The healthcare team should immediately stop the transfusion, provide oxygen, and initiate supportive care. TRALI requires prompt management in an intensive care setting. In the long term, to prevent future incidents, the blood bank may consider using leukocyte-reduced blood products and screening donors for HLA antibodies. What is the role of the AABB guidelines in blood transfusion practice, and how do these guidelines influence transfusion safety? Answer: the AABB, American Association of Blood Banks, sets standards for blood transfusion practices to ensure the safety and quality of blood products. These guidelines cover all aspects of transfusion medicine, including donor screening. AABB provides strict criteria for donor eligibility, ensuring that blood is safe from transmissible diseases. Donors must undergo detailed medical histories and physical examinations, and blood is screened for infections like HIV, hepatitis B and C, and syphilis. Blood processing and storage. The guidelines specify procedures for processing blood, including proper labeling, component separation, and storage conditions to preserve the functionality of the blood products. Compatibility testing. The AABB emphasizes the importance of accurate blood typing and cross-matching to prevent transfusion reactions. This includes guidelines on antigen antibody testing and the use of modern techniques like molecular typing, transfusion reaction management. The guidelines provide protocols for identifying, treating, and reporting transfusion reactions as well as managing adverse events such as hemolysis, TRALI, or graft versus host disease (HE). What are the common complications associated with blood transfusions and how can they be prevented or managed? Answer: common complications include hemolytic reactions occur when there is incompatibility between donor and recipient blood, resulting in the destruction of red blood cells. Prevention includes strict blood typing, cross-matching, and adherence to the AABB and FDA regulations for compatibility testing. TRAI, transfusion-related acute lung injury. As discussed, this is caused by donor antibodies against recipient leukocytes. Preventive measures include using leukocyte-reduced blood products and selecting male or previously transfused female donors. TACO, transfusion-associated circulatory overload. This occurs when the volume of transfused blood exceeds the patient's circulatory capacity. Management includes careful monitoring of transfusion rates, particularly in patients with cardiac conditions. GVHD, graft versus host disease. This is a rare but serious condition where donor T cells attack the recipient's tissues. It can be prevented by using irradiated blood products in immunocompromised patients. Explain the process and importance of cross-matching in blood transfusion. Answer: cross-matching is a laboratory procedure used to ensure that the donor blood is compatible with the recipient's blood. This is typically performed after blood typing and involves mixing the recipient serum with the donor's red blood cells to observe whether agglutination occurs. There are two types of cross-matching. Major cross-match. The recipient serum is tested against the donor's red blood cells to identify any antibodies that may cause a reaction. Minor cross-match. The donor serum is tested against the recipient's red blood cells, although this is less commonly performed in modern transfusion practices due to advances in blood typing techniques. Cross-matching is critical in preventing transfusion reactions, particularly hemolytic reactions, and is a key component of FDA and AABB transfusion safety protocols. What are the regulatory requirements for blood donor screening and why are they important for transfusion safety? Answer: regulatory requirements for blood donor screening are set by the FDA and AABB to ensure that blood donations are safe and free from transmissible infections. These include donor history. Donors must answer questions about their medical history, including risk factors for infectious diseases such as HIV, hepatitis B and C, and syphilis. Physical examination. Donors must undergo a physical exam to assess their overall health and suitability for donation. Laboratory testing. Donated blood is tested for a range of infections, including HIV, hepatitis B and C, syphilis, and West Nile virus, among others. These guidelines are essential to prevent the transmission of infectious diseases through blood transfusions and are enforced by the FDA to ensure the safety of blood products. Ms. Martinez is a 30-year-old woman who recently had a transfusion of red blood cells. She now presents with fever, chills, and back pain. What is the most likely cause of these symptoms, and how should the healthcare team respond? Answer: Ms. Martinez's symptoms are suggestive of an acute hemolytic transfusion reaction (OTA), which is typically caused by a BO incompatibility. This reaction occurs when the recipient's antibodies attack the transfused red blood cells, leading to their rapid destruction. Response: the healthcare team should immediately stop the transfusion, initiate supportive care, and provide hydration to help with the clearance of hemoglobin from the bloodstream. AHTR is a medical emergency and may require interventions such as renal protection to prevent kidney failure due to hemoglobin-induced renal damage. Additionally, the transfusion reaction should be reported according to FDA and AABB guidelines, and an investigation should be conducted to determine the source of the error. What is the role of ISO standards in laboratory operations, and how do they relate to laboratory quality management system (QMS)? Answer: ISO standards, specifically ISO 15189, are critical for establishing and maintaining a quality management system (QMS) in laboratories. These standards set international requirements for the competence, quality, and reliability of laboratories. A QMS based on ISO standards ensures consistent delivery of accurate, precise, and timely laboratory results, which is essential for patient safety and effective medical decision-making. Laboratories must implement these standards to gain accreditation from bodies such as the College of American Pathologists, CAP, ensuring they meet global benchmarks for quality and reliability. The standards also help manage laboratory operations by requiring continuous improvement, risk management, and regular internal audits. Its adherence supports the laboratory's role in clinical diagnostics and enhances credibility in healthcare. Relevant guidelines laws. ISO 15189, CAP accreditation. How does HIPAA compliance influence data management in a laboratory, and what steps must a laboratory take to maintain compliance? Answer. The Health Insurance Portability and Accountability Act, HIPAA, is a U.S. federal law that mandates the protection of patient data, including clinical laboratory test results. HIPAA compliance in laboratory data management involves safeguarding electronic protected health information (FI) and ensuring patient confidentiality. Laboratories must implement secure data management practices, including encryption of patient data access controls, regular audits, and staff training on data privacy and security. In addition, laboratories must establish policies to govern data sharing, ensure proper disposal of FI, and have a clear breach notification protocol in place if data security is compromised. Non-compliance with HIPAA regulations can lead to severe penalties, including fines and loss of accreditation. Relevant guideline source: HIPAA, Health Insurance Portability and Accountability Act, 42 U.S.C. SS 1326. Mr. Davis, a laboratory manager, has just discovered that a critical lab instrument is not operating within the specified calibration range. What steps should Mr. Davis take to address this issue and ensure quality control? Answer. Mr. Davis should immediately initiate the following actions. Stop using the instrument. To prevent inaccurate results from being reported, the instrument should be removed from service until it can be recalibrated. Conduct an investigation. Mr. Davis should work with the technical staff to identify why the instrument is out of range. It may involve checking the calibration procedures, environmental factors, or maintenance history. Review quality control QC data. The laboratory must assess whether recent test results may have been affected by the instrument's performance and take corrective actions, such as rerunning critical samples. Implement corrective actions. Once the cause is identified, a corrective action plan should be implemented to bring the instrument back within calibration limits. This may include recalibration, maintenance, or repairs. Document the incident. The issue must be documented in the laboratory's quality management system, (QMS), and the corrective actions must be logged for future reference. Follow-up assessments should ensure the problem is resolved. What are the key elements of lean principles in laboratory operations, and how do they contribute to operational efficiency? Answer. Lean principles aim to eliminate waste, streamline processes, and improve overall efficiency in laboratory operations. Key elements of lean in a laboratory setting include value stream mapping, identifying and analyzing all steps in the laboratory workflow to ensure that each step adds value. Non-value adding steps are considered waste and should be eliminated. Standardized work, creating standardized procedures for common laboratory tasks to ensure consistency, reduce variability, and minimize errors. Continuous improvement, Kaizen, encouraging a culture of constant process refinement where small incremental improvements are made regularly. Pull systems, ensuring that laboratory tests are only performed when required, based on demand rather than in anticipation of demand, minimizing inventory and excess work. Flow and fives, organizing laboratory spaces efficiently and ensuring smooth, uninterrupted workflow through practices such as sort, set in order, shine, standardize, and sustain. Fives. By applying lean principles, laboratories can reduce wait times, enhance productivity, reduce error rates, and lower operational costs. Explain the relationship between Six Sigma methodologies and laboratory quality management systems. Answer. Six Sigma is a data-driven methodology that aims to improve processes by identifying and eliminating defects. In the context of a laboratory's quality management system, QMS, Six Sigma focuses on reducing errors in laboratory processes and enhancing overall process efficiency. It uses a structured approach known as DMAIC, define, measure, analyze, improve, control, which involves define, identifying the problem and the process to be improved. Measure, gathering data to understand the extent of the problem and to set baseline metrics. Analyze, identifying the root causes of defects or inefficiencies. Improve, implementing solutions to address the identified causes. Control, establishing control measures to ensure the improvement is sustained over time. Six Sigma complements laboratory QMS by providing a systematic approach to reduce variability, improve accuracy, and ensure high-quality results. By integrating Six Sigma into the laboratory's QMS, it ensures continuous improvement and fosters a culture of quality and precision. Relevant guidelines laws. Six Sigma methodology ISO 9001 CAP. What are the OSHA guidelines regarding chemical hygiene plans in a laboratory, and why is it critical for laboratory safety? Answer: the Occupational Safety and Health Administration (OSHA) requires laboratories to develop and implement a chemical hygiene plan (CHP) under the Occupational Safety and Health Act, particularly under 29 CFR 1910.1450. A chemical hygiene plan outlines specific practices to protect laboratory personnel from chemical hazards. Critical components of a CHP include identification of hazardous chemicals, listing all chemicals used in the laboratory and their associated risks, proper labeling and safety data sheets (SDS), ensuring that chemicals are properly labeled and that SDS are readily available for all hazardous substances, exposure controls, defining procedures for handling, storing, and disposing of chemicals safely, including personal protective equipment (PPE) such as gloves, goggles, and fume hoods. Training, ensuring all laboratory staff are trained on the risks associated with chemicals, safe handling practices, and emergency procedures. Emergency procedures, developing protocols for chemical spills, exposure, and accidents, including eyewash stations and emergency showers. In the context of laboratory safety protocols, how should personal protective equipment (PPE) be used effectively to ensure safety in handling infectious materials? Answer: personal protective equipment (PPE) is a critical component of laboratory safety protocols, especially in laboratories dealing with infectious materials. Effective PPE usage includes selection of appropriate PPE, the type of PPE selected, the gloves, gowns, masks, face shields, respirators should be based on the specific risks associated with the work being conducted. For example, handling blood samples or biohazardous materials requires gloves, lab coats, and possibly face shields or respirators. Proper donning and doffing. Laboratories must train staff on the correct procedures for putting on, donning, and removing, doffing PPE to prevent contamination. PPE should be put on before exposure to hazards and removed carefully to avoid contaminating the wearer or the surrounding environment. Maintenance and disposal. PPE must be maintained in good condition. Reusable PPE should be decontaminated properly, and disposable PPE should be discarded in biohazard waste containers immediately after use. Compliance with biosafety levels. Laboratories handling infectious agents should adhere to the appropriate biosafety level (BSL) guidelines. For example, BSL-2 requires gloves and lab coats, while BSL-3 labs may require full-body suits and respirators. How can a laboratory implement an effective corrective and preventive action (COPPA) system to address nonconformities and improve operations? Answer: an effective corrective and preventive action (COPPA) system helps a laboratory identify and address nonconformities and operational inefficiencies. The CAPA process involves identification of nonconformities. Nonconformities can be identified through internal audits, patient complaints, quality control (QC) failures or incidents, root cause analysis. Once a nonconformity is identified, the laboratory must perform a root cause analysis to determine why it occurred. Tools such as fishbone diagrams or the 5 whys technique can be used to identify underlying causes. Corrective actions. Corrective actions are taken to address the immediate problem and prevent it from recurring. This may involve retraining staff, updating procedures, or repairing faulty equipment. Preventive actions. Preventive actions aim to identify potential risks and prevent them before they result in nonconformities. This may include implementing proactive maintenance schedules, revising policies, or introducing new safety protocols. Documentation and monitoring. All actions taken must be documented, and the laboratory must monitor the effectiveness of the CAPA system through follow-up audits or quality assessments. How does CLIA certification impact the operational procedures of a laboratory, and what are the essential components of maintaining CLIA compliance? Answer: the Clinical Laboratory Improvement Amendments (CLIA) certification is a mandatory requirement for laboratories performing diagnostic testing in the U.S. CLIA ensures laboratories meet quality standards for testing accuracy, reliability, and timeliness of results. Essential components of CLIA compliance include laboratory accreditation. Laboratories must obtain CLIA certification by submitting an application to the Centers for Medicare and Medicaid Services (CMS) and undergoing inspections. Quality control (QC). Regular QC checks must be conducted to ensure accurate results. Laboratories must maintain control over their equipment, reagents, and processes. Proficiency testing. Laboratories are required to participate in proficiency testing programs to evaluate the accuracy of their results and ensure they meet or exceed regulatory standards. Personnel qualifications. CLIA mandates that laboratory personnel be properly trained and qualified. This includes ensuring that lab directors, technologists, and technicians have the necessary credentials, records, and documentation. Laboratories must maintain detailed records of all testing procedures, results, and audits to demonstrate ongoing compliance with CLIA regulations. How does the CAP accreditation process enhance laboratory operations and patient care? Answer: CAP accreditation is a prestigious recognition that laboratories achieve by meeting rigorous standards for operational excellence, quality, and patient safety. CAP accreditation benefits laboratory operations in several ways. Rigorous standards. CAP standards cover a broad range of laboratory operations, from testing procedures and staff qualifications to safety protocols and quality control. This ensures laboratories meet or exceed industry standards. Continuous quality improvement. CAP accreditation promotes continuous improvement by requiring regular internal audits, proficiency testing, and the implementation of corrective actions when needed. Enhanced credibility. Being CAP accredited assures patients, healthcare providers, and regulators that the laboratory consistently delivers accurate, reliable, and timely test results, leading to improved patient care. Adherence to best practices. CAP accredited laboratories follow best practices for operational efficiency, personnel management, and regulatory compliance, all of which contribute to optimal patient outcomes.